There are 3 stages of healing when following a bone injury. These include the inflammatory stage, the reparative stage, the remodeling stage, and these occur within that order. The inflammatory stage would usually last anywhere between a few hours to days following the injury. Genevieve is displaying symptoms of the inflammatory stage, as she has a swollen wrist, which occurred from her landing on an outstretched arm the night before, and the amount of pain she is experiencing both supports the time frame for the inflammatory stage injury. There are 3 phases to the inflammatory stage of healing: the cellular phase, the vascular phase, and the formation of the primary callus. Genevieve is expected to still be within either the cellular phase and or the vascular phase, as she is describing her wrist as both painful and swollen, indicating that the inflammatory response is still being activated and hematoma is occurring, releasing growth factors and cytokines to repair the blood vessels, tissues, and to clean up the debris. Genevieve is aware of her varicose veins. Varicose veins is when the vein walls will stretch and the valves weaken, resulting in a backflow of blood and pooling within the vein. It is something that occurs most commonly in pregnant women and those who have been standing for long periods of time, which can both be seen in Genevieve's case. Genevieve expresses her discomfort by explaining that her varicose veins are sometimes uncomfortable, especially after standing for long periods of time, which as a stay-at-home mum with 2 young children, it would be very hard to manage. Some clinical signs and symptoms of varicose veins include: the veins are seen as a dark bluey purple, the veins will appear twisted and bulging and may even be palpable. When Genevieve is experiencing the discomfort, it can be seen as an ache or a heavy sensation feeling within her legs, which indicates that she is enduring the worst stage of varicose veins. Varicose veins and thrombophlebitis are both present within the superficial veins and are created from a larger localization of stationary blood within a vein. Varicose veins are seen visually as dark, lumpy, purpley blue lumps and swollen veins. They are most likely within the legs and predominantly within the calf region. For unknown reasons, the walls of the veins begin to stretch and the valves weaken, allowing for a backwards pooling of blood. Thrombophlebitis is a very tender cord-like vein and appears red in colour and quite firm to touch. They are most commonly found within the saphenous veins, which is a vein that runs along the inner section of the leg from the hip to the foot. This occurs when there is damage to the vein, creating an inflammatory response, allowing for possible heat and mild swelling within that area. Thrombophlebitis is a high chance of developing when the blood flow slows down or stops within the vein, or the blood has a greater likelihood of clotting. Varicose veins do not simply go away on their own and would require either surgery to remove or sclerotherapy to seal the vein. In undergoing these treatments, it does not mean that there would be an impact of blood flow throughout the body, as other veins will take over, and not necessarily meaning that they will not continue to develop. Thrombophlebitis, on the other hand, will dissipate on its own within 2 to 6 weeks, depending on the situation.
Endurance training, also known as aerobic exercise, can result in several changes in skeletal muscle. Genevieve, through her regular gym attendance, would possibly see changes in the number of capillaries surrounding the muscle fibre increase. Secondly, an increase in the number of mitochondria within the muscle fibre. And finally, a skeletal adaptation Genevieve may see as a result of endurance training is her fibres synthesize more myoglobin, which is a reservoir for oxygen within the muscle. Referring to the biopsychosocial model, physiological factors, whether biological, social, or physiological, influence Genevieve's case tremendously. Various factors can be categorized into multiple physiological factors as there is often an overlap between factors. Genevieve's physiological factors, such as genes, that influence her case include Genevieve's mother passing away 2 years ago, and Genevieve talks about her alcoholic addiction. When Genevieve describes the pain of her injury the night before, she mentions that she had a few glasses of wine prior to the fall, and jokingly refers to it as Mummy's little helper, or 3 to 4 glasses a night, just like everybody, which indicates her social issues are also influencing her drinking habits, as she uses it as a stress relief. Her father also had a cardiovascular history, a heart condition that induces deceased vessels, structural problems, and blood clots, which would have increased Genevieve's likelihood of developing varicose veins due to the predisposing risk factors to developing blood clots. Genevieve's likelihood of developing varicose veins due to the predisposing risk factors of blood clots made her get diagnosed with varicose veins. And this doesn't help her socially, as her husband works late, so she is often on her own and on her feet for long periods, looking after her 2 children, which triggers the onset of discomfort from her varicose veins, as she describes it is a common symptom after long periods of standing. Genevieve's drinking of alcohol makes it harder for her prefrontal cortex to work as it should, disrupting decision-making and rational thought. This could have influenced her falling, as when the little dog came over, she was unable to react at her full capacity to stop herself from tripping over. Genevieve describes her overall health as okay, but is very tired due to the stress of the children and the general monotony of life. Both physiological factors of stress and having children with ADHD and adequacy will put an emotional toll on her mental state, despite having assistance by a nanny 4 days a week. Physiologically, she is doing a good thing by going to the gym in the mornings when the nanny comes as exercise, as her body releases chemicals called endorphins, which interact with receptors in her brain that reduce your perception of pain, as well as triggers a positive feeling in the body. Seeing friends for lunch after gym is also another physiological positive thing, as she gets time away from the children to have a mental break away from the stress. However, the alcohol is an antidepressant, which can make depression worse, also increases side effects such as dizziness, which could have contributed to her fall and tripping over the dog.